Hello, I'm Rico Caviglia, and I want to welcome you to your Ageless Body self-care training on how to best take care of your teeth. You will learn how the health of your teeth greatly affects the health of your body. And you're going to learn the very latest information on how to holistically take the best care of your teeth. We want you to know that our bodies are meant to be healthy and long-lasting, and that most of the common health challenges that so many people are dealing with are not natural, and we do not have to accept them as normal. So our goal is to offer you the latest cutting-edge, proven scientific information and strategies that you can trust from some of the top experts in the world that you can begin immediately incorporating into your daily lifestyle. And so it's really our goal to help you to take the very best possible care of that amazing gift you have, your physical body. So this is about creating your healthiest, most energetic, best functioning, long-lasting body as possible. So we're very fortunate to be able to have Dr. Martha Cortez as our dental expert. She's a holistic biological cosmetic dentist in New York City. So welcome, Dr. Cortez.
Hi, hello Rico. Hello everybody. Teeth are so interesting.
Yes, they are. They certainly are.
Really are, because each one tooth is an organ.
Wow.
And that one tooth actually has stimulation to the brain. The one tooth actually has a function on this thing called the homunculus groove. Each tooth has proprioception and sensation to the brain. So each tooth is really important to keep. And then it has all this wrapping of gum tissue and bone around it for also proprioception, but that we need to do daily care. So what we do every single day is what really counts in the mouth. It's not what you do sometimes, like go to the dentist. The best thing is real brushing.
Yeah.
A vitamin regimen that includes D3, because that is going to substantiate that bone and those gums with some K2. So the vitamin D3 should be at least 10,000 international units, which is 500 mcgs, or 1 hour in the sunshine. And so that is what part of what's important of the teeth. It is the gateway to the body. Because of the teeth stimulating the brain actually has a way of functioning, accepting messages in from the body, of which it now has to decipher all the information. So good functioning brain will actually take all the stimulation, all the signals, and actually reduce them to proper relaying. And that's what a good brain is. There is no pain in the body. There is balance, and the chemistry works really well to sustain the body. Removing teeth is a big deal. Yes, ask me.
No, yeah, I was just going to say, you already started to answer my first question was, you know, how really important it is the health of your teeth to the overall health of our body.
It's very healthy, because if losing one tooth alone will change the sensation proprioception to the homunculus brain, that groove in the brain. And removing that tooth really should be replaced by some kind of ceramic implant, not titanium. If you have to remove the tooth, if there's an infection, if there's an old root canal, if the tooth cracked because of grinding. And the reason you replace it, because it has an electrical circuitry to the brain, and therefore it maintains the brain healthier. A healthier brain has all the teeth it can. It's so important. A healthier brain detoxes through the posterior part of the brain if it's allowed to stay healthy. And part of its health is actually if there's any infection in the jaws, it goes down to the neck and can actually go to the back of the neck and actually congest the back of the brain. The posterior brain is where you have the detoxing by these things called glial cells, the glial lymphatics, so that it's really important to maintain any infections out, because it's going to hurt your brain.
Yeah, so in other words, yeah, so in other words, you can really determine the health of your body by the health of your teeth. Would you agree with that? Yeah, it's so important, and it really does.
The brain.
It affects our brain. Well, obviously, if our teeth are affecting our brain, because our brain is what's sending the message to all of our body how to function, right? So that's why it's so vitally important. Well, tell us, what are some of the most common dental issues that you see in your practice, and what are the main causes?
What's interesting is periodontal disease and gum inflammation is still one of the top. It's 80% of the patients, of all of us. Residual infection in our gums, in our bone, from wisdom teeth issues, from old root canal issues, from periodontal disease diving down and taking away bone. And another thing is crooked teeth. And the crooked teeth brings airway issues and asymmetry of the face and the airway. That's the secret, airway.
So I remember we have talked before. We've done a podcast together before, and you mentioned that when your teeth are not aligned properly and they're crooked, it really affects your breathing, and that really affects your sleep.
Yes. Well, okay. So let's talk about crooked teeth. How do we end up with crooked teeth? Well, first thing is the baby is born, and if the baby by chance has a tongue that's tongue-tied, so that like a sail, if we have a sailboat and the sail is pulled in, it can't really be free. The same way the tongue cannot be free if it's tongue-tied. Mm-hmm. If it's tongue-tied, it cannot feed well because it cannot breastfeed as well as it should. So the jaws don't develop well. That affects the swallowing, that affects the breathing. That now makes smaller jaws. And smaller jaws doesn't allow the full genetic expression of those teeth to be aligned straight and in a line with the right vertical and with the right neck. Because sometimes you can even have straight teeth, but the neck, where the neck goes the back into the skull, is forward head posture, which now we're talking about not breathing correctly. So crooked teeth implies airway issues.
So it's really important to get those dealt with, right? It's very important to get, crooked teeth are going to really affect the overall health of your body. So what are the
tongue, the breathing, the breastfeeding, that's all, which now affects the breathing. And some of these kids can end up with ADD, ADHD, can end up with acid reflux, where they put them with proton inhibitors, a baby, an infant. Wow. The mother's frustration of just breastfeeding the baby, but then now we have residual issues with sleep disorder breathing that weren't addressed early enough, because that tongue tie needs to be released within the first few days of life.
So what are some of the latest holistic ways that you treat this condition of crooked teeth?
In my practice, what's interesting is I don't even look at the teeth. So what I do is one of the things is I really do sleep studies more than not, because there's an epidemic. People not breathing correctly. Either they breathe only from their upper body and not deep inside, because they're so small inside. A lot of them have the forward head posture. Is it really the electronics, or is it that they weren't breathing well from the beginning anyway? That the adenoids not allow them to develop well, and they have a very nasally voice. And the reason being is part of the oral cavity went into the nasal space. So it's also compressed. And sometimes even the compression will cause asymmetry of the face, often the left side being smaller, and that's part of that nasal, but it was the adenoids, the allergens, the rhinitis, the mouth breathing. Could have been genetic, but it's also the epigene. What's on the outside? Was there mold? Were they allergic to the dog? The gerbil, the little mouse pets. You never know what it really could be. You have to follow. And the best way to do it, therefore, if the bone is small and jaws are small, is develop them wider. You could use removable appliances as well as fixed. There are different ones that can be utilized. One of them is known as the DNA because it expands. Now it's called Vivos. There are guides for babies, for instance, from 3 years old on. There are ALFs. There are DNAs, which are wires also with a key. Nowadays, there's even ones that you implant to adults, you implant into the bone, the upper jaw, to develop, because it's come to the realization that it's the upper jaw, not the lower, that's the biggest problem in breathing. And that's for airway. So the sleep studies is to ask whether they have sleep apnea, a sleep disorder breathing, because that will take down the brain. Why? Because it will lower the oxygen. Now, there are some people who are sort of sleep disorder breathing, they grind. So all the everything they ever do is they grind. In their sleep, they grind their teeth. That's themselves. It's now, through university studies, considered a movement disorder, which means that while they're sleeping, the oxygen often goes down and they wake themselves up by grinding. Wake up, wake up, wake up. The only thing is the teeth get really shorter and shorter. So if they don't do anything and preventive about this, they're going to end up with short teeth. And then let's say 15 years of it, because it's going to take down 50% of the tooth structure. They're going to get spaces between the teeth, and even some of the fillings will have fractured off. So now they have spaces. And those spaces now have to have crowns. But now those crowns may need to be full mouth reconstruction because they need to also open up the vertical that they diminished by grinding. Mm-hmm. So what we do is we expand the jaws, make room for the teeth to fit in and to be aligned.
Really good information. Well, what about cavities and fillings? I know, most people really think that's the biggest problem they have. But so when a person has a cavity and it needs to be filling, tell us about the latest and the best fillings that are built.
Let's approach it another way, because cavities to me is almost like periodontal disease and gum disease. You have to ask, what's really the primary cause? Mm-hmm. Actually, it's the deficiency of D3.
Okay.
Because if what I do with people with mild to moderate gum and periodontal disease and cavities, I put D3 at least 10,000 with a K2 of 100 mcgs. For children, you're right. With children, we make sure their D3 is their children. You're 1,000 to 2,000 international units for them. But in addition, you have to make sure they have minerals. Sometimes they're not absorbing their minerals. So if I have a child that shows up with like 3 cavities, 9 cavities, and they're very young, the first thing I would try to do is actually remineralize those teeth with the D3 and the minerals and brushing. We have to change their behavior. Brushing really well. Did I say flossing? No, I said brushing, to try to reverse, because it is feasible to reverse. And then ask the question, why cavities? Cavities don't really happen. Just like bone disease, it's really not that. It's the regimen of vitamins. They're not absorbing really well. So I rely on regimen of vitamins. Now, again, as why a little kid gets a big hole, big black hole, that they're going to need root canals on baby teeth and maybe the 6-year-old molar. Again, it's the airway. Look at cavity as an airway. It is a symptom of something bigger happening. You need to expand and open up that airway.
Okay. That's such good information. Okay, but if a person does have to have a filling or have a crown, what do you recommend? It should be all ceramic, right?
Oh, the best is ceramic.
Yeah. You shouldn't have any metals in your mouth.
Yeah. Metals is not the best in our human body. Mm-hmm. Metals, especially now, metallic ions is not going to be our best. Matter of fact, when we have the removal of a tooth, the best time to take care of that space is to take the tooth out and actually put a ceramic implant. I like SDS, which is Swiss Dental Solutions, for one reason, more than my Z implant, because when I do a fresh extraction of a root canal or a tooth or a molar, I'm able, it's a little longer, can be a little longer, and it's a little wider, that I can actually fit it into where not exactly where the tooth was, but actually slightly off-centered into original bone, and then fill it, the cavity around it, with PRF, plasmin-rich protein, which is harvested blood of the patient in that time, that immediate appointment, and we make membranes. By spinning the blood by a certain timing, and we fill in the rest of it. You end up with original bone. It is not a bone synthetic. It is not a cadaver bone, so that it rises, it actually accelerates its healing because of all the natural growth properties that the membrane has from the blood. So that's one. So you do the immediate tooth, you never lose the bone. You don't have to do grafting from animals or other humans. And you actually are able, I call it the smart graft, because where there's bone, it'll fill in with bone. Where there's gum, it'll fill in with gum. If it's tight gum, it'll have tight gum.
What I'm getting from all this is that it's been really important if you can find a holistic dentist.
I would go biological.
Yeah.
And what we're saying biological, because there's things like the way the tooth is removed, there's a piece for minimal invasive surgery, there's ozone, there's a gas ozone, not an injection, but an actual, it's almost like a little glass foot that you're actually cleaning all those areas. It's just a little more training. I'm trained out of Switzerland twice. First Paracelsus Clinic 22 years ago, and now Dr. Volz, the Swiss Biohealth Clinic. And the reason I went again is because in Switzerland, they were reversing autoimmune disease. What is going on in the USA with all this autoimmune disease? And that is why I further advanced trained there, because I really want to be a warrior against all these things. That's why I went into dentistry. I am such a warrior and passionate about like what can be done to really bring the best out. I got the leadership award in gym for high school. Okay, the reason I did is I love teaching these young women how to use their bodies, how to be healthier. I like them, I like to see the eye open and the inspiration to want to do the right thing for themselves. And so I like to do all this because of that. Being the warrior to help people get rid of these diseases. They're bad. In the mouth, they're bad because they spread.
Right. Well, your passion really comes through, and that's why I'm so happy to have people like you as our experts, because all of our people have really passion to really help people really improve their health, because it's just so important for every aspect of our life. It's really hard to be very successful or really happy in our life if we don't have really good health. So I think you've pretty much answered some of my other questions already, but if we could kind of make a little summary of what would you say would be your, say, 3 to 5 best tips that people should be doing on a daily basis?
It sounds silly. Brush your teeth 2 minutes plus. Just you put the little brush angled 45 degrees into the gum, and you actually brush the gum. It's half on the gum and half on the tooth, and you count. You do 3 of the teeth at a time, and you brush it. 1, 1,002, 1,003, 1,000, and then you start going down 1, 1,002, 1,003. Move forward 1 tooth. 1, 1,002, 1,000. It really does take 2 minutes. The inside, I've met people who didn't brush their inside of their teeth. No one ever showed them.
That's funny.
And then all the gum disease was on the inside, and the pus, all the swelling and inflammation, perfect on the outside and all swollen on the inside.
Wow.
So the inside has to be in and out. Every tooth again, 1, 1,002, 1,003, 1,000. So you get 5,000 to 6,000 per tooth. And it takes over 2 minutes. So brushing first. I believe in the regimen of D3 with the K2. Mm-hmm. Because you know what? You can reverse osteopenia. Do you know how many women have osteopenia and they go on into osteoporosis and they're put on the bisphonates? Mm-hmm. And all they had to do was ramp up that D3 early enough, K2. Some women may need hormone supplementation, bioidentical hormone, because the bone is just not sustained, because the minerals are maintained by hormones, not just the D3. And what's interesting, if I were to take an x-ray behind the second molar, that area starts decreasing the bone quality, and I know they need to go for hormones. But back there in the wisdom teeth is also areas of residual infection, by the way, that also need to be addressed, cleaned out, ozoned, and PRF, where wisdom teeth have been removed, which can actually have a meridian. You know how the meridians, like the electrical circuit of a house, of a building, goes to certain areas? Well, they point to where the heart is. So somebody with cardiac issues may have some neurotoxins from those areas that are hurting them, in addition to the lymphatics. So what would be else? I still love exercise, because exercise brings nitric oxide, and it's one of the best hormones for the body. The food does make a difference. Although for the past 2 weeks, I have been eating a little more comfort food, because we have to allow ourselves to also be like that. So the concept of 80% wonderfully brilliant as possible, 20% it's okay. Because if we're so harsh on ourselves, then we're gonna not be as kind to ourselves and compassionate to ourselves. We need to be kind and compassionate to ourselves and people around us. Fear, it doesn't belong in ourselves. Inspiration, what we can do and help each other, and work. We should be working.
Absolutely. So good. So thank you so much for all that great information. I always learn a lot every time I speak with you. And so for people who want to learn more about Dr. Cortez and what she offers and all her trainings, and she's written many books, you can find all her information, how to contact her, and all the information about her books and, uh, and reports in the PDF that accompanies your program here. So you can find out how to contact her as well. So Dr.
Yes,
Cortez, that was so good.
my apology. There's
Yeah.
ebooks coming on, the small ebooks on all these on tongue tie, pregnancy and sleep apnea, the 7 phases of sleep disorder breathing. Wake up, your sleep is killing you. But there I have one thing to say.
Okay.
Think Brilliant Brain begins in the mouth.
Begins in the mouth. It's all about the mouth. Yeah.
It really is. As I get older, oh my word, what a field that I chose. Blessings.
Well, thank you for all your good work. I really appreciate that. So both Dr. Cortez and I want to remind you that we have so much good knowledge these days, but knowledge without action is useless, right? So we want to urge you to take this opportunity to really embrace this knowledge and all the recommendations from all of our experts that are offering. So because we know it'll absolutely make a big difference in your health and your enjoyment of your life. So the healthier you become, the better your life becomes, and the better the lives that everyone you touch becomes as well. So thank you so much, Dr. Cortez. That was fantastic.
Thank you so much.